symptoms of inflammatory bowel disease in a 15-year-old girl can be ulcerative colitis, Crohn's disease, ulcerative colitis. It can be kidney disease, bloody diarrhea, and mucus, recurrent urgency, abdominal pain, and cramps, tinnitus. The Crohn's disease immune related to foreign bacterial low-grade fever, weight loss, fatigue, chronic diarrhea, abdominal pain, area preferable abdominal mass, or absorption, anemia, bowel drive, pain on the fistula or abscesses. Clinical manifestation depend on the region of involvement. Colitis with either combination observed in diarrhea, blood and mucus in the stool, urgency and cancerous association of incomplete empty after defecation. Symptoms of colitis always present in UC and usually suggest the diagnosis early in its course. Toxic neurocolonies are life-threatening complications characterized by fever, abdominal distension and pain, basically dilated colon, anemia, and low cell hemoglobin owing to fecal protein losses. Extraintestinal manifestation of UC may include primary sclerosing cholangitis, arthritis, rheumatitis, and pyoderma gangrenosum. Small bowel involvement in CD is associated with loss of appetite, crampy posture, prandial pain, growth, delayed puberty, fever, anemia, and lethargy. Pain abnormalities include skin tags and fistula, another fistula. Distinguishing CD from UC, inflammatory bowel disease, which includes Crohn's disease and ulcerative colitis, can present with various symptoms in a 15-year-old girl. The manifestation may vary depending on type and severity of the disease, as well as the specific areas of the gastrointestinal tract involved. Crohn's disease or the extent of the colon involvement in ulcerative colitis. Gastrointestinal symptom, abdominal pain and cramping, often the lower right abdomen for Crohn's disease and may be more diffuse in ulcerative colitis. Diarrhea can be persistent and may be contained blood, especially in ulcerative colitis. Irritability more common in ulcerative colitis, but can occur in Crohn's disease if the lower part of the intestine is involved. Urgency to defecate, particularly noted in ulcerative colitis. Constipation can occur in Crohn's disease, especially if there is a significant involvement of the small intestine. Systemic symptoms may lose due to reduced appetite and association of nutritions. Fatigue or common complaint, often due to anemia or the chronic inflammatory state, fever may occur, especially during flare-ups. Growth and development will delay the growth and or puberty due to chronic inflammation and malabsorption. Malnutrition. Extraintestinal manifestation, joint pain, arthritis, particularly in the larger joints. Skin disorders such as erythema nodosum, tender red nodule, usually on the skin, shins, and pyoderma gangrenosum, people's skin ulcers. Eye inflammation, including uveitis, which can cause eye pain and vision changes. Most ulcers can be recurrent. Most ulcers can be recurrent. Complication of stricture, particularly in Crohn's disease, leading to bowel obstruction, symptoms like severe cramping and bloating. Fistulas more common in Crohn's disease can lead to infection, bowel and abscesses. Increased risk of colorectal cancer, especially with long-standing ulcerative colitis. Diagnostic approach, blood tests, looking for signs of inflammation, elevated CPRP, ESR, and anemia. Stool tests to check for blood in the stool and to rule out infection. Endoscopy and colonoscopy with biopsies to visualize the extent of inflammation. Tissue samples for definitive diagnosis. Imaging studies such as MRI or CT scan to assess the small intestine in Crohn's disease or complications in both conditions. Managed medication including aminosalicylates, corticosteroids, immunomodulators, and biological therapies aimed at reducing inflammation. Nutritional support to address and prevent malnutrition. Surgery may be necessary for complications like strictures, fistula, or significant colorectal dysplasia or cancer. High point in a 15-year-old girl with IBD symptoms can range from gastrointestinal complaints like abdominal pain and diarrhea, or to systemic effects such as weight loss and fatigue. Gastrointestinal manifestation, including joint, skin, and eye movement, highlight the systemic nature of IBD. Management is multifaceted, involving medical therapy to control inflammation and surgical intervention for complication with a significant focus on maintaining nutritional health and monitoring for growth delays. Okay, so let's sum up. So in terms of inflammatory bowel disease, within your or ulcerative colitis or Crohn disease, if ulcerative colitis with the autoimmune bloody diarrhea with mucus recurrence, abdominal pain, cramps, tetanus, if Crohn disease, low-grade fever, weight loss, fatigue, chronic diarrhea, abdominal pain, palpable abdominal mass, occlusion, anemia, failure to grow, perineal fistula, or abscesses. Clinical manifestations, diarrhea, blood and mucus in the stool, urgency and tendency sensation of incomplete emptying after defecation. Symptoms of colitis, all which are present in UC and usually suggest a diagnosis early in its course. Toxic colon is a life-threatening complication. Fever, abdominal distension, pain, intestinal manifestation, you see prevalence sclerosing, cholangitis, arthritis, uveitis, hyaluronic gangliosome, small environment, loss of appetite, crampy postprandial pain, poor growth, delayed puberty, fever, anemia, lethargy. Abdominal pain and cramping, diarrhea, irregular breathing, urgency to defecate, constipation, weight loss, fatigue, fever, delayed growth or puberty, joint pain, arthritis, skin disorders, eye inflammation, multiple ulcers, stricture, fistula, increased risk of colorectal cancer, blood test, stool test, endoscopy, and colonoscopy, imaging studies, medication, nutritional support, and surgery. Joint skin, eye involvement, abdominal pain, diarrhea, weight loss, fatigue, medical therapy control, and intervention for complications. Okay.